Thank you for joining. The webinar will begin in a few minutes.
Hey, Kama, just so you know, the webinar we're doing right now is a public health update from the health department in St. Charles, also some discussion about masks and conflicts, period.
Thank you for joining. The webinar will begin in about a minute.
Hello, everyone. It's noon, and I want to welcome everyone to the Ben Chambers COVID Impact webinar series. Today, we are very fortunate to have some fabulous folks from St. Charles and also from Deschutes County Public Health to give us an update about how the health aspects of the COVID outbreak are going. We've talked a lot over the last weeks and months about business impacts, about OSHA regulations, those types of things. And today we're really going to hear about the other side of the house. What is it like at the hospitals, and what is it like, and what are they hearing in the public health sector about how this battle is going? So we're very, very excited to have three panelists rather today. Emily Freeland, she's a senior environmental specialist from Deschutes County Public Health. And Dr. Jeff Absalon, he's a chief executive physician from St. Charles. And Jen Wielander, she's CFO at St. Charles. Each of them will have a different presentation and a few different topics to talk about. But before we get started, I wanted to do a few shout outs, little recognition to some folks that are making these webinars and the Chamber's work really possible. So we couldn't be doing all of that we're doing without the help of US Bank, Robertson Ford, Cascade Natural Gas, First Interstate Bank, Compass Commercial, and Pacific Source. These are our lead sponsors and investors in our organization, and they're helping us bring these types of programs together for you, our greater community, and businesses here in Central Oregon and Bend specifically. I just wanted to take a moment to thank those lead sponsors. If you are interested in being a Chamber member or investing in some of these programs that we're doing to help ready the workforce, help get information and resources out to you, please let us know at info@benchamber.org, and we'd be happy to talk with you. Few things before we get started have happened in the last 24 hours. Yesterday, Governor Brown held a press conference announcing some more restrictions with mask wearing. Anyone who is 5 years old and above needs to wear a mask, and is recommended for 2-year-olds and above. Closing bars and restaurants at 10 o'clock. Also, indoor venues, maximum is going to be 100 rather than 250 where we were. All of this is statewide, and your peeps, your family units that you can go out and about with, is limited to 10 as well statewide. And then this morning, it may still be going on, there was a special city council meeting talking about how do they work with the Bend Parks Department, Parks and Rec. I know I have seen some pileups along the riverfront in the last few weeks as tourism season has started to peak. And they will be working, the city will be working with Bend Parks and Rec to talk about how to regulate that. And also talking with agencies like the police and other agencies that are working on really starting to enforce the wearing of masks, especially indoors. And as always, remember, wear face coverings, make sure you stay 6 feet apart, and make sure you wash your hands a lot. These are the things that we know. That's what the science is telling us. And so just a gentle reminder that businesses in Bend don't want to be the ones to ask you to do this, and just hoping our customers and we as community members remember to do that, to take care of one another. With that, I'm going to get us going on today's program. And first up is Emily Freeland. And she's going to share with us, well, she's going to be talking to us a couple of times today. First and foremost, she's going to share what we're seeing here locally. How are things changing as we've seen the influx of tourism as happens this time of year? And what are they finding? What are the difficulties in adding to the mix, folks from the outside and contact tracing, et cetera. So with that, I want to hand it over to Emily, and thank you for coming today.
Thanks, Katie. Happy to be here today and share some information from our local public health and our contact tracing team. So let me just share my screen here real quick. And then, shoot, where did... Somehow, all of a sudden, my presentation
happens all the time.
How strange is that? Okay, let's try again. I'm sorry. I tested this and it was right there. There it is. Okay. Okay. So as Katie said, I'm Emily. I am an environmental health specialist and do lots of work surrounding business outreach and helping people. But today I'm also going to kind of present and share some of the epidemiological data that we have and kind of the trends that we've seen, you know, in the last couple weeks. So as most of us know, you know, tourism season is in full swing, and we've had lots of complaints and questions and, you know, wondering what's happening with the numbers. So there's probably two reasons. Yes, we can talk about tourism and how that puts a strain on our system, but just also reopening, people going out and about, and we're seeing the trends from that even before we were having that kind of heavy tourism season, just from people, you know, reopening their doors, socializing more, going to bars and restaurants, those kinds of things. Those numbers are going up. So as you can see here, this is weekly data broken down, and you can see that the week of 7/13 through the 19th, we had our highest case counts. So a couple things to remember about this data is these are residents of Deschutes County only. So we don't track or know necessarily if we have cases outside of Deschutes County. So even if you're diagnosed within our county, if you live somewhere else, those numbers are reported there, whether it's another county or another state, or if you're here or if you're visiting, we don't have a way of tracking those numbers. So last week we had 84, which was by far our highest case count. Let's see. So as you can see, this is inside and outside of Deschutes County week by week. Again, the cases in Oregon are continuing to rise, as though not as much as we saw with the rise here in Deschutes County locally. So this is just a little graph that kind of describes all of the types of symptoms that are reported. You can see here that most people do have some sort of symptoms. About 75% of people in Oregon reported some symptom. And then down from there, we can see that the types of symptoms that people are experiencing are very wide ranging. And so I think that's one of the hard things that comes when people start to get sick is, you know, we might not have one of those typical symptoms that we commonly associate as the most common symptoms, but something else. and we decide not to stay home because we don't think it's associated. So this is a graph that shows the cumulative cases in Deschutes County. You can see that the slope or the trajectory of this graph is rising. So that's, we're seeing more cases more quickly, which is not what we really want to see. So we want to see something flattening out. We heard that early on quite often, is flattening the curve. And we can see right now we're kind of going in the opposite direction. We're having this steeper, slope. So it is what we would have expected to happen. And as you have more cases, that's more contagion in our community, in our environment, and more people are going to get sick. So that's why we talk about all of those important precautionary measures we can take to help, protect ourselves from that contagion that is in our community. This is the case numbers cumulative for the whole state, and you can see a similar trend, although it doesn't appear to be quite as steep, but that trend of a rising slope is going there. So in Deschutes County, we have slightly more females being diagnosed than males. So why that is not necessarily clear, but it is one of those demographics we can track. Another thing we talk a lot about is travel history. So, travel history helps us determine whether people are picking it up locally or somewhere else. And we see that about a third of people do have some sort of travel history. And this is a risk factor. It's not necessarily that we can trace it to a specific source. It just means that, before they became sick, they did travel. So the links we are seeing, we see lots of household cases. So you can see in this chart, the blue is the cases just from July, the patterns that we're seeing. And then the gray would be the rest of the months. So we do have an outbreak. Probably most people heard that we had the larger outbreak that was in a long-term care facility, so memory care. So that information was out, and those numbers are associated in that outbreak category. There's also others that are like clusters. So those are small, and then sporadic, that's cases we don't necessarily know. There's not a direct link to someone else that we know was sick. So we're not really sure where those people got that. Could be in the community, it could be close contact with someone they didn't remember. It could be close contact with someone that was asymptomatic but was still contagious. Those are those sporadic cases we're not really sure. And then household, those are obviously like within the same household, one person gets sick and then one or more people are diagnosed from that. So here's a graph that just kind of breaks down the age groups that we're seeing. So this is cumulative data over the entire course of COVID in our community. You can see that, the younger age group, so 20 to 29, that is a significant portion of the cases that we're seeing. I think that we've spoken probably quite a bit about social gatherings and whether or not that is younger people or older people, those still, COVID is still spreading in those groups. So we have those numbers. This chart is a little confusing, but it shows the total number of tests that we've had given in Deschutes County. So 14,769 tests total. Of those, only the 361 of those were positive. So, we're seeing more cases, but we also need to remember that there is other sicknesses that are going around that are consistent with the symptoms of COVID. So it is really important to realize that, if you're sick, it is important to get tested to try to determine, work with your physician or primary care provider to try to figure out if this is COVID related or not. Testing is super important. So recovery is another question we get quite often. So how long does it take someone to fully recover after they become sick? Most people, as you can see here, take 1 to 2 weeks. So generally speaking, that's the average is 2.3 weeks. But sometimes it takes much longer than that, depending on the severity of the illness. You can see that 10.7 was the longest time that it took for someone to recover. So that's a pretty significant illness if you think about the amount of impact that would have on your life to be sick for that long. So this chart shows by month the percentage of cases in each age range category. So May is obviously an anomaly, which we had a much larger percentage of people that were under 30. But currently in the month of July, so this is as of 7/14, just so you know, our data is usually updated on Thursdays. So we'll get new data out today. But it wasn't ready for the time to make this presentation. So you can see that we're having a lower number of people in that under 30 category, with about half of the people in 30 to 59 that are being diagnosed. So you also have to think when you're, comparing these March and April, we had way fewer cases than we're having currently. So these numbers are also reflective of that. If it's 100% of the cases in those categories of the months. This chart is a similar chart. So all of them add up to 100 and it shows, what we were seeing over time. So clusters and outbreaks are about 33% currently, 31% are known linkage. So that's like that community spread that we don't really know how someone got it. And then we have a household linkage in about 35% of people in this month. Last month, you could see that we had a much higher percentage of clusters and outbreaks. So a couple things we're wanting to see is we want to know where people are getting sick so that we can isolate and quarantine those people and we don't spread it as much in the community. But the better job we do of that, then the more we're going to see of this unknown linkage. So the known linkage doesn't mean that we didn't do the contact tracing or those interviews were not conducted. It just means that we weren't able to track that person back to a known source. So this is again another one that shows kind of how many specimens or how many tests we're seeing per week, and our testing capacity is based on that. So some of it's based on testing capacity and some of it's just based on how many people are requesting tests, right? So if we have less sick people, then we're going to probably have less tests administered. So and the other thing is the number of positive tests may not be reported for this last week because we are seeing some testing delays. So I kind of touched on this already, but traced to a known source. Again, that doesn't mean that the contact investigators didn't do their job or that they weren't able to get a hold of someone. It just helps us better understand if there's more community spread or less community spread, or if we can trace, it's also that asymptomatic spread perhaps. We just don't know, and there's no way to necessarily determine that. So that's kind of all I have for this section, and then I'm gonna talk a little bit later about those business considerations when you have those positive tests. So as we see more and more people testing positive, that's affecting more businesses, and they are having lots of questions on how to handle that. So I'm going to stop sharing now and let some other people who know more information about hospital data and some other things share their perspective, and then I'll hop back on towards the end. Thanks.
Thanks so much, Emily. That was really good information, and a lot of questions are piling up in the Q&A. I forgot to mention, if you do have a question for our speakers, we will have a little bit of time at the end. Please put them in the Q&A section rather than the chat section. That button allows us to talk to each other, but we're monitoring the Q&A. So if you want your question asked, that's where it goes. So next up is Dr. Jeff Absalon, Chief Executive Physician for St. Charles. He's going to share with us what's happening in the area of hospitals, what areas of concern are happening, and things businesses and the public should know from their perspective. And so with that, Jeff, I'm going to hand it over to you.
Thank you, Katie. Appreciate that very much. Thank you, everybody, for joining today. I appreciate the time to spend with you and share what's happening at St. Charles. And I'll be joined by Jen Wielander, our Chief Financial Officer, who also will be a part of this conversation. So we're going to talk about a number of things today. These are the highlighted areas that we'll be addressing together. And maybe go to the next slide if you could. Here's where we are today. As of this morning, we have 16 COVID-19 positive patients in our hospitals. 5 of those are in the intensive care unit. I will share with you that this is essentially our second surge of patients in the hospital. The first surge that we saw peaked in early April. With that surge, it was interesting that over a period of 2 or so weeks, we went from 1 patient up to 14, and then back down to 1 patient over the next couple of weeks. And what we're seeing now is a bit different. And that is that now for 7 or 8 weeks, we've seen a steady incline in patients, and we just continue to go up. So today is the highest number of patients we've had in the hospital throughout the entirety of this pandemic. And so we just surpassed the 14 this morning with 16 patients. We do model this to see what we may expect for the future. I will share with you that the modeling is just that, and it's very dependent on what we all do as community members in terms of protecting others from this disease and protecting transmission of the disease, which we all know can occur in people that are not having symptoms. But it's clear that there is a possibility that we'll continue to see increasing numbers in the days and weeks to come, and this is really important to us. Next slide, please. This outlines the last 10 days, and the blue bars show our hospital admissions, and you can see how there's a little bit of up and down here, but generally speaking, the trend is significantly upward. The orange bar is the number of patients in the intensive care unit, likewise increasing, and the gray bar indicates the number of patients that are on ventilators, also likewise increasing. And I think this just highlights what we're seeing on a day-to-day basis and the concerns that we have generated associated with this. Next slide, please. We are publishing this information and being transparent about it. And I think that's important. We know that it's important to everybody to be aware of hospitalizations. Lots of comments we hear about the increase in number of positive patients in the community and whether that's due to increased testing or not. I would share with you from my perspective, the number of hospitalized patients, I think, is a really true indicator. And so seeing those numbers come up is as strong as anything that I can think of to share the importance of the fact that this virus is in our communities. It continues to propagate through, continues to make people very sick, and continues to be an incredibly important issue for us as healthcare providers, and I think to all of you as community members as well. We have made some decisions in this process to share with you, and one of the things that we've decided is to make sure that we would cohort our patients in our Bend hospital that are positive, and so we continue to do that whenever possible. We have lots of questions about our ability to handle these surges and the number of patients that we can take care of if these numbers continue to increase. It's summertime in Central Oregon, as we all know, and visitors have arrived. And we typically have busy volumes during the summertime. And honestly, this is no different than any other summer. So we continue to see people with acute illnesses, people with accidents and injuries that require hospitalization. And on top of that, these COVID-19 patients. Recognizing that this is a time of year when we typically do not see influenza. This is really an add-on of the 16 patients, as it were, today, above what we might otherwise expect. But I know there's a lot of curiosity about our ability to handle this, and so I want to just share a few comments about this. Under normal circumstances, we do sometimes need to transfer patients out of our area for care. This sometimes is because they need a level of care that can only be provided at a university hospital, as an example. but we also do have times where we hit our capacity at times. In the state of emergency, we have the ability to increase our capacity here locally, which is something that we don't necessarily have under other circumstances. And we have put together significant plans to allow our ability to accommodate these surges. One example, and a real life example that we're actually utilizing today, is that the number of patients that require beds in our hospitals, as well as ICU beds, sometimes is related to elective surgeries or surgeries that have been scheduled and need to be performed. And so our capacity is high today. This morning we were at 87% capacity for our intensive care units. And we are going through the process of assessing which surgeries that are scheduled for later today and tomorrow will be able to go forward and which ones we may need to postpone so that we can accommodate room for sick patients. And this is an example of the work that we do on a regular basis, is of course intensified at this time, but what we do. We also will have the ability to transform some of our non-ICU beds into ICU level beds. We have additional ventilators available, and we remain prepared. I think that you all know we've been doing this since January in terms of our preparation, but we do need your help, and it's absolutely critical that your actions can help prevent the spread of this disease and the number of sick patients that require our services. And this is really important that everybody abide by the wearing of face masks, washing hands, keeping physical distancing, and staying at home when you're sick. Next slide. I want to talk to you a little bit about testing. This is really an important topic for us. We all know that in order to contain this virus, we need to be able to identify who has the virus and then isolate those individuals. There have been lots of tests done here locally, and thank you, Emily, for sharing the data. At St. Charles, we've done more than 13,000 specimens collected. And we have the ability to do testing in-house as well as to send out specimens. The reality that we're facing right now is that we are seeing a decreasing amount of supplies in order to do in-house testing. Our in-house testing allows us to get the results back very quickly. And as mentioned, our supplies are diminishing. So the majority of our tests are being sent out, and there still is a turnaround for those tests of a number of days, as an example. Just yesterday, Jen and I had a conversation with the governor, asking for assistance in getting more supplies. And the reality is that our state is not at the top of the list in terms of allocation of supplies for these testing. So it's a limitation and a challenge that we're facing, and a reality that we have at this time. Next slide, please. So our numbers, we have in our laboratories identified 249 positive cases out of, you can see the number 13,000, and we still have a number of tests that are pending presently. The last slide that I have is, before I turn this over to Jen Wielander, is just to talk about our other supplies. And when this pandemic started, there was a lot of attention about personal protective equipment, or PPE, in particular masks and N95 masks. And our teams have been working very hard to secure these supplies. And we're in a much stronger position today than we were 3 months ago, earlier in this pandemic. But I'll also share with you that we're very concerned about the ongoing ability for us to secure these supplies, particularly with the demands that are being placed on companies that provide these supplies, with the surging of cases throughout the United States. So we're in a strong position today, but something that we're very cautious about, and continues to be something we're careful about. And then last off, I'll mention to you that we've been able to treat sick patients with a number of medications, and we've had very good success here with regards to the outcomes. But we're also concerned about the supplies of antiviral medications that are effective against this disease. We do have them on hand at this time, but as our numbers increase, we are increasingly concerned about our ability to have these medications available for everybody who needs it. Again, another reason for all of us to do everything that we can in order to reduce the spread of this disease. I am now going to turn this over to Jen Wielander to talk about the finances, and I appreciate your time this morning or afternoon.
Thank you, Dr. Absalon. I appreciate that. So we will discuss some of the financial impacts, both the immediate term, what we're seeing, and then some of the longer term outlook that will impact all of us. So through June of 2020, our net operating loss is 18 million. That is significant. We would not have budgeted, or we don't budget a loss. So we would have been expecting to be performing at a small operating income at this point in our year. That 18 million is after the recording of $22 million in CARES Act funding that we've received from the federal government and through what is called provider relief funds. So had we not received and recognized that 22 million, our loss would have been significantly more, approximately 40 million. We did receive some additional funding in early July, and we are holding a bit of our CARES Act funding in reserves because the audit requirements and the detailed calculations for what amount of that you get to keep have not yet been released by the federal government. Those are expected in late August. So we remain in a very fragile financial situation in terms of our operating performance. I do want to say, though, that things have started to improve in June. June was the first somewhat return to where you might see normal at the end of a tunnel. So our volumes and revenues in June returned to within 5% of what we might expect. The outlook and the projections, however, they remain pretty fragile. One of the things, and Dr. Absalon spoke to this, is as we look forward, our patient flow, which is heavily impacted by surgical volume, can be immediately disrupted if we hit a bottleneck in our facilities, whether that be in the ICU or the number of open beds that we need to have to serve the community. So depending on how much we have to throttle back volumes and restrict care, that impacts our outlook. And in addition to that, it's not simply about what is going on in the hospitals, it's also very much about what's going on in the community. And where do people go when they're discharged from the hospital? Into SNFs, which are skilled nursing facilities, nursing homes. So as you hear about outbreaks or clusters in places that may be where a patient goes after leaving the hospital, those have a significant impact on our point of view about the capacity that we need to have and manage to serve the community. So with the federal funding and with the ability to return to a bit of our normal behavior in terms of providing the needed patient care, our outlook has improved somewhat, but we remain very concerned about the growing number of cases and the impact that can have. If we look at longer term, it really, we are going to be a reflection of the economy. So this is our unemployment rate, or our employment rate and unemployment rate in Oregon. What you can see, the red line is the current recession. The other lines are other recessions, 73, 90, 2001, 2007, and 1980. So you can see the sharp nature of what we're experiencing. And so how the job recovery occurs is going to be very important. There was just a report released recently by Health Management Associates that forecasts that as many as 430,000 Oregonians could lose their employer-sponsored health coverage in the coming months. And we're starting to see that. I'll share that in a minute. And what that may mean is that there could be as many as 320,000 new enrollees turning to the Oregon Health Plan for their insurance coverage. And we are already starting to see that. And this is information from the Oregon Health Authority on the total Oregon Health Plan enrollment, so Medicaid. This is where the state of emergency was declared, and you can see as of July 13th, across the state of Oregon, there had already been a 7.6% increase in enrollment. What we are seeing in Central Oregon is actually higher than that. So from February until June, we've seen a 10% increase in the Central Oregon enrollment in the Oregon Health Plan. So those are significant impacts. As we all know, government payers pay significantly less reimbursement to hospitals and physicians for the care provided. And so as we start to see the significant shift in the economics of our patient population, that's going to have very long-term, severe and lasting changes to our business and our point of view about our business. So I would say, just as Dr. Absalon talked about with capacity and surge planning and supplies, our financial performance and stability remains very fragile. And is going to hinge upon how we, again, work to flatten the curve and learn to manage with COVID without peaks and valleys in that virus. So with that, I will go back and hand it back to you, Dr. Absalon.
Thanks, Jen. And just to close from the St. Charles side, we also do want to remind everybody that we take all the precautions necessary to keep patients as well as our caregivers safe, and our facilities are safe for care. One of the problems that we did see early on in this pandemic and continue to see today is that some people are delaying coming in to get much needed care. So if you have an acute medical condition of any sort, please do not delay coming in for care. We're here to take care of you and urge you to come in to get the care that is much needed. And then last of all, please, as mentioned several times already, wear a mask, wash your hands, keep 6 feet of physical distancing. And if you're sick, please stay home, contact your care provider for advice, etc. This is in our hands, so to speak, and we are feeling the pressures of increased spread and the strain on our health system, and we ask for your help in this regard. So again, thank you so much for your time today.
Great. Thanks so much for the information, both of you. We're going to turn it back over to Emily to talk a little bit about more of a business-facing discussion on getting compliance from customers. This was a big discussion in City Council today, and what to do if a staff member, and I know we all on this call, probably on this Zoom meeting, have had an experience of discomfort with folks who don't want to wear a mask, or you've observed it in some way. And so, Emily, what words of wisdom do you want to share with us on this?
Thanks again, Katie. I am going to touch on masks and trying to get compliance, but the first thing that I wanted to kind of address, which is what I really see as a concern and a huge issue that tons of businesses are facing, and probably more and more will in the next short while, is what you should do when someone tests positive. So there's lots of things to think about here. And I think very early on in this, I talked a lot about continuity planning. So planning for someone to test positive and how that's going to affect your business. We've been through so many ebbs and flows, and early on didn't have a lot of cases, then a lot of businesses were closed. So I think that kind of, we kind of forgot that in the midst of everything else because there were so many things to deal with and so much information. But it's back on people's minds now because they're dealing with those positive cases. And then also secondary, so the contacts of cases, and then tertiary would be the contacts of contacts. Employees are worried, businesses are worried. And I think in speaking with lots of different people, I've kind of broken this down into, there's 3 things that are happening. What must you do from a legal perspective? What should you do, or what are some of the best practices when this happens? And then the third one is what the public thinks you need to do. And those three things can be wildly different. There can be many different answers to those. And as most of you probably know, the court of public opinion is probably the most difficult to deal with. So I really recommend that everybody kind of does a simulation on the extent of exposures in the workplace. So think through in your business, if somebody got tested positive, who else would be affected? Who would be this close contact? So right now, when the contact tracers do their investigation, so as soon as a positive case comes into the team, they get that information and they call the person on the phone. They do a really thorough investigation and ask a lot of questions to figure out who they have been within 6 feet of for more than 15 minutes during the 48 hours before they exhibited symptoms, if they're a symptomatic person, or if they were tested positive and they're asymptomatic 48 hours before that test was administered. So, thinking through that piece and who was in your facility or who would be affected if you had a positive case can be really helpful. And then really thinking through, is there any way you can change what you're doing so that more people are protected, so that if you do get a positive case, you're not out of workers. Another thing to really consider that can be really difficult is exposures among staff that when they're not at the workplace. So I know there's lots of places where you're doing a really good job. Everyone's masked up, washing hands, sanitizing surfaces. Everyone's, their stations are more than 6 feet apart. You don't let people in the break room together, all of these things. But then as soon as everybody's off the clock, they go and have beers together, or they go to a party at someone's house, or maybe they live together. And these are really difficult things to control because they're not something you can control as a business owner. But you can talk to your staff about how that would affect their jobs and their, you as a total business. So, talking to them about that. And then if you possibly can, thinking through if there's roommates that also work and live together, scheduling those people together so that if either of them are positive, they are exposing each other because they're already doing that in their home environment. So instead of John working with Jeff, and then John also living with Mary, maybe John and Mary work together during the same shift. So I highly recommend trying to think through some of those things. Another question we get a lot is, what about a symptomatic employee? So what happens when I have this symptomatic employee between the time they're symptomatic, then maybe they're testing, then it takes 4 to 7 days to get the test results. What do I do during that time and how do I handle that? So the first thing we would say is if they become symptomatic while they're at work, send them home as soon as you possibly can. Isolate them and get them away from other employees. The next thing is request that they see their provider to be tested. So you can call the COVID hotline and they can give you really good information on where to get tested and different ways to get that done. If the individual refuses to be tested, then the return to work guidelines would be the same as if they would have a positive test, if they have those same symptoms, cough, fever, shortness of breath. So screening for symptoms is another common question we're getting. So, there's kind of a difference between explained versus unexplained symptoms. So examples, if I have a runny nose, it's recently onset. I don't exactly know what it's from, but I'm 90% sure it's allergies. I don't want to be out of work for 10 days. I don't think I need to take a test. What does the employer do in that situation? We would recommend maybe sending them home and letting them take their allergy medication that normally works for their allergies. If it resolves based on that, or if they can go to their doctor and get another diagnosis, then you can allow them back to work without, testing necessarily or waiting that long. Same with like diarrhea. I get lots of questions around that. Of course, if you're in a food facility, you need to follow rules surrounding that, which is, foodborne illness rules. But someone thinks it's, oh, I just, I'm lactose intolerant. I went and had this drink and I think it had some milk in it and I didn't know, can I come back to work? Well, again, if it resolves in a time period that correlates with that, then yes, you can probably allow them back. But if they have 2 or more of those kind of symptoms and they are not related, we would certainly recommend that they see their provider to get tested. So again, multiple secondary symptoms, or unexplained symptoms that you don't really know where they're from. It's really important that people are trying to get in to get testing. So again, I just wanted to kind of go over, because we get tons of questions on what happens when this positive case is identified. So once there's a positive lab report, they're sent to public health. So as you might imagine, sometimes people get a call from their doctor right away and it says you're positive, you need to stay home. And then they'll send out a mass text message to all their friends and say, I tested positive. And then all kinds of information and rumors are going around. Meanwhile, it takes a little while for public health to get that information. But once they do get that lab report, they call the affected individual and they ask them lots of questions, trying to identify those high risk close contacts. Like I said, that's defined at this point as at least 15 minutes within 6 feet. At this point, there's not any information on whether or not masking is in there. And part of that is because we know that masks are worn incorrectly. There's many different types of masks, and the risk that's associated with those are not well described. We are hoping for some more investigative guidelines to come out that will hopefully speak to these things. But at this point, it's just that 15 minutes within 6 feet. Those people are identified as high risk or close contacts, and public health calls those people directly. When they call those close contacts, they don't tell them who the positive was. They just said, you were identified as a close contact of someone who tested positive for COVID-19, and here is what you should do. They provide that person with a letter that describes exactly what they're supposed to do and when they're released from this quarantine period. And they can provide that to their employer. So if you have an employee who says, I was a close contact of someone who was positive, they should be also able to give you that letter. But again, remember, some of this takes some time. It doesn't happen immediately. Another thing that happens often is that the people weren't together within the period that the COVID positive individual was contagious. So if I saw a friend 4 days ago, they became symptomatic today, the risk is low because they wouldn't have been contagious on the day that we saw each other. So every positive case is asked to isolate, and then the close contacts again are asked to quarantine. And there is that really clear information on when they're released from the isolation or quarantine. A lot of people are asking if public health will close a business. This is not generally the case. We don't, unless there's a large reason to close a business, there's a imminent health hazard that's happening, we don't typically do that. However, oftentimes, if many staff are exposed and they're asked to quarantine, the business might not have enough staff to continue to operate without those employees. Often I find that a pause of a day or two is sometimes helpful. So not closing for a full 2-week period, which can be, economically not feasible, but taking a pause of a day or two to help, figure out who, what, when, where, why, do the investigation, feel confident in that, these staff are exposed, these staff are not, what's the extent of that, clean and sanitize the facility, and then you can reopen. Again, another question, public notification. It's generally not required. We certainly don't, do that often because we're trying to protect, there's HIPAA requirements and we're protecting that information. But if you decide to do a public notification because you are worried about that kind of third category, what the public thinks you need to do, please work with us to make sure that the information is clear and concise and there's not misinformation there. If you do have an outbreak of at least 5 positive employees, if you have at least 30 employees, that is released by the Oregon Health Authority. And you can, there's a long list of those outbreaks that happen in the workplace. So again, what are the current rules for ending isolation? So if you're a positive case, when do you get to go back to work? At this time, it's 72 hours have passed after you had fever, and your symptoms are resolving, and it's been at least 10 days since you're positive, your symptoms began. If you are asymptomatic, it's just 10 days from the time that you took that test that was positive. Quarantine, so those are those close contact individuals. They're asked to self-quarantine for that 14-day period from when they were around the contagious individual. And as long as they don't develop any symptoms during that time, they're released at the end. When should staff and contacts be tested? So we do generally recommend testing for close contacts. The caveat here is that we want to make sure it's done at the correct time. So anyone who is symptomatic should be tested again, and those people are placed in this category of presumptive positive. And asymptomatic close contacts, the timing of the test really does matter. So at this point, again, we're waiting for some really solid information from Oregon Health Authority on when the best day to test is. But generally, it's probably between 4 and 7 days post-exposure. If you test too close to the exposure, the chances of a false negative are really high. And if you test too far out, again, same thing can happen. So the test result only means that the individual did not have the COVID virus detected at the time of testing. It doesn't mean that the individual does not have the disease, and it doesn't change the quarantine period. So if you're asked to quarantine for that 14-day period, even if you get a negative test sometimes during that period, it doesn't change what we're going to ask as far as that goes. So a quick thing on masks. I know we're running out of time here. Masks are obviously a really, really hot subject. As Katie mentioned, there's lots and lots of, information on they work. We want people to wear them as much as possible, obviously. This is just an example of some really pretty clear-cut data. There were these 2 hairstylists. They spent at least 15 minutes with 139 clients, and no one was known to be infected from those high-risk exposures. So we really want to encourage people to wear face coverings. That being said, we know that there's people that aren't going to want to do that for a plethora of reasons that we don't really need to get into. But there's a couple things that most of you probably know. It is a business's responsibility to enforce this. And part of the reason is it's a known hazard, right? So we know this is spreading in our community. We know people could have it, and it's your responsibility as an employer to protect your employees. So that's an OSHA rule. So if you know there's a hazard, if you know there's asbestos in a building, you can't just send people in there to clean that up or demolition that building without giving them the PPE they need to protect themselves. So this is a similar thing. If you know somebody could be walking in your business and they could be COVID positive and we don't know it, it's your responsibility to protect your employees from that hazard. So if you haven't looked at these couple websites, OSHA and the ADA have some really good information about face mask policies and lots of questions that come up around that. I highly recommend you go to these 2 pages and look at this information. So again, if somebody says I have a medical reason for not wearing a mask, it is your responsibility to offer them an accommodation. That doesn't mean they just don't have to wear the mask. It means that they can do something else. They can wear a face shield. You could change duties so they're not in a public facing area and they can maintain 6-foot distance. They could do telework. There's lots of different options here, but you can work with them on an accommodation for staff. This is the same for patrons. So again, if a patron refuses to wear a mask and they tell you it's because of a medical reason, doesn't mean they just get to continue on into your business without a mask. It means there should be something else that you do that allows them, whatever your service is or your food or whatever, but it doesn't mean that they can just come in. Anecdotally, I've actually heard from quite a few businesses that when people are told this, that they don't just get to come in without the mask, that they're going to need to go back out to their car. They can order online and we'll bring it to your car, or you know, whatever it is, a lot of people choose to go ahead and wear the mask. So again, I know this is a really hard thing, and I feel for everyone who's dealing with the reality of trying to enforce face masks. You all are not, that's not your job, right? Typically you're not enforcement people. I know personally for me, becoming comfortable enforcing rules was super difficult. Finding the language and the different skill sets, how to help convince people that it's a right thing to do, it was very difficult. One thing that I think that can be really helpful is to commiserate with that person and say, I don't want to wear a mask either, and I wish I didn't have to have you wear a mask in here. Like, not turn it, I mean, some people are not going to convince that there's a public health threat, first of all, and second of all, that masks are going to help that threat, right? There's no way we can convince them. And so turning it around from, these are rules that if I don't follow as a business, I can get in trouble. And some people will help that. So even if you commiserate with them, whether you agree or not, just say, yeah, I really don't agree with this either. I don't like it. I don't want to do it, but I have to do it. And if I don't do it, I can get a fine. I can get in trouble. I think sometimes that helps. You know, we don't want to threaten people. That's not what we want. We want this kind of voluntary compliance, but we know that that doesn't always happen. So it's super difficult. And again, that's kind of what I had there. So I'm happy to answer any questions, and I hope that was a little bit helpful in describing some of the ways that you can handle those positive cases in the workforce, because I know those are questions we're getting daily, if not multiple times a day. So,
yep. Emily, thanks so much. And thanks to Jen and Jeff as well. We have about 6 minutes for questions. So I have been looking at the Q&A section here, and I'm going to start off with testing. There's more than several questions around testing. How effective is it? And I guess, in other words, how accurate are you finding the tests? And Emily, I heard you mention the best time to take a test if you're asymptomatic. If you could just go over that one more time, asymptomatic and being a contact trace versus symptomatic, and how accurate it is. And then I'll have a follow-up, but that's enough for the first question.
So I can say what I know about this. There's a couple things. I mean, there's varying data on this. Different places are recommending different things. But for asymptomatic people, we think that between 4 and 7 days after that close contact is probably the best time to catch the infection if you're going to be asymptomatic with the test. Some states are recommending 5 days. Some states are recommending 7 days. You know, we're waiting for the Oregon Health Authority to give, hopefully, you know, a little bit more concrete detail on when the best day is. I don't necessarily know that we know, as most things, the more data we get, it's not that the data is changing, it's just as you get more information, the best practices are going to change. And that's how it always is with science. It's always, you know, but usually we have a body of information that's pretty strong to start with, but because this is so new and there's so many variables, it's really hard to say. So 4 and 7 days usually. Again, we've probably heard a lot about that false negative rate, which is true and it's real. And from my perspective, I really worry about behavioral changes. So I know that if people get a negative test result, it's like a get out of jail free card, and I might behave in a different way, right? So I might not be social distancing. I'm not wearing a mask because I had this negative test result. Well, it could be a false negative, but also walking out of the building, I could have contracted it. So it's something that's in our community, and, you know, it's just that point. There wasn't enough virus to detect. It doesn't mean really a lot more than that. So I don't know if anybody has something else to add. I would be happy if.
Yeah, this is Jeff. I'm happy to add a little bit to that too. As Emily said, this is difficult because there's lots of variables, and it is also a moving target. A lot of the tests that are being used right now were issued emergency use authorization. And under that program, so to speak, there's not a requirement to publish the sensitivity and specificity of the test, which means how many false negatives, false positives, et cetera, will be coming out of that. So we're learning more about this as things go. Not all tests are the same. Some appear to be more accurate than others. And there are lots of other factors in addition to the timing of symptoms or not symptoms, how many days, whether an adequate sample was obtained, whether it was a nasal swab or what we call a nasopharyngeal swab, which is a deeper swab. So it's very difficult for us to get our hands around that. We've heard a lot of the 30% false negative comments as well. And we've seen some studies with the tests that we're using that are much better than that, but it's something that honestly in this environment, we cannot say with absolute certainty where that sits. But it is true that false negative tests are a real thing, and it's something that we all need to be aware of.
Great. Thank you for that perspective. Lots of questions in the queue around kids. A lot of folks concerned about children going back to school. There was a case in childcare facility. And Emily, I know that yesterday the governor announced 5 years old and above is mandatory. And God bless you if you have a 2-year-old and you want to put a mask on them, and good luck. But down to 2 years old as really recommended. As far as, let's start with the hospital's perspective. How are you seeing any changes in the amount of cases of young people? And if you could share a little bit about how the hospital is preparing for that, for the varying age groups. And I know, Emily, you had data on that too. Any thoughts on that?
Most of the patients that we see hospitalized with this disease are either people that have associated medical conditions or are older, but that is not an absolute. And we have seen some younger patients hospitalized, and we're prepared and here to take care of patients as they present with illness. Our ICU is not a pediatric ICU, and so fortunately, this disease does not frequently affect children in that way, but it does sometimes. And certainly if that were to occur, we would need our partners in Portland to help us in that environment.
Okay. Any last thought on that, Emily?
Just we're working with the school districts as the best way we can to help keep them informed of all the information that we have. We're meeting with them, talking to them, weekly, often more than that, depending on what school district you're talking about, to help them make the best decisions for the students. It's not easy for anyone. As businesses know, it's difficult. There's no right or wrong answer. There's no easy answer. How do you protect everyone, but still do the things you need to do, whether it's have your business open and make money or educate the kids. So,
right.
Yeah.
And I do know the governor's COVID team is coming out with metrics for childcare and schools next week. So we'll have more information on that next week. And the chamber will be sharing that data, probably getting it out via our e-news system as well. We're also trying to nail down a date for next month for the school district to be in one of these webinars to start talking about what will school look like in Deschutes County, Ben Lapine District. What are the expectations as far as safety protocols, whether their kids will be in school, and we as parents and the community, how do we support them in their endeavors to try to be semi-normal as we enter into the school year. So stay tuned on information for the date for that. I am going to have to wrap it up. There's many other questions in the queue. Greatly appreciate everyone's time today. And we're grateful for St. Charles, everything you're doing to keep our community healthy. And you too, Emily, and the county. It's a team effort, and businesses as individuals are part of that team, but we sure rely on you folks to help us out in getting good data. And so thanks very much. Thanks everyone for joining us today, and we'll see you in a couple of weeks.
Thanks, Katie.
Thank you all.